arteries, okay, are muscular or distributed. Okay? Right. So arterioles are almost microscopic, okay? So those arteries, arterioles, capillaries, venules, veins. Okay? So these can regulate blood flow. These are regulate our blood flow. Okay? And capillaries are microcirculation, are very, very small. Okay? You're gonna see, right, we saw the red blood cells are very, very small, right? The red blood cells, okay, red blood cells just about fit through capillaries. That's how small capillaries are. Okay, so remember, it's arteries, arterioles, capillaries, venules, veins. Okay? That's important, know that. Okay? Remember, capillaries have no tunicate media or externa. Okay? You just have tunicate interna with a thin basement membrane. Okay? Three types of capillaries, continuous capillaries, right? They're gonna be arterioles, capillaries, venules, okay? But then we have specialized capillaries in our kidneys, okay? And our liver, our spleen, and our red bone marrow. These are for filtering, okay? So these are capillaries that have little holes in them. These holes in the kidneys are called fenestration, okay? It means pores, okay? So what we're gonna do is we're gonna filter our blood through the kidneys. So red blood cells, white blood cells, platelets can't get through, they're too big. Large and medium-sized proteins can't get through, too big. Okay, but small proteins, amino acids, glucose, electrolytes, water, okay, creatinine, they can't get through. Okay, so they're small. So the kidneys filter out our blood. Okay, also, right, that kill microorganisms or filter out any type of cellular debris is going to be our sinusoids. They tend to be a little wider in the fenestrations. These you're going to find in your liver because we detoxify our body. Our spleens, like the lymph node of the blood, and our red bone marrow. Okay? This would be like what a continuous capillary would look like. You see the red blood cells, yeah, that's about a fifth row. Okay? And this would be sinusoids. The fenestrations would be some small holes. Okay? Right? So the capillaries go into venules, and the venules go into veins. These tend to be very porous. Okay? This is so our white blood cells, or phagocytes, can get into the interstitial spaces, okay, and fight any microorganisms that may come into our body. Okay? All right? Okay. Again, veins have the same layers, okay, as arteries. They're just thinner, okay, and they're not able to withstand that blood pressure. Okay? What prevents the backflow is they contain these valves. All right? So this is what it looks like. So these are the capillaries here, right? So all of these little spaces, these all be cells. Okay, so cells are going to get nutrients and oxygen and get rid of our CO2 and all waste products. Okay? That. Okay, and again, valves prevent the backflow. Valves are going to prevent that backflow. Okay? That. Okay, so I like to keep things real light. So sometimes these valves get leaky. Okay? Okay, they call varices or varicose veins. Okay? This is when the veins become twisted and dilated, they can bulge out. And they do tend to run in families, so it's a congenital thing. Mechanical stress, people that stand in one place all day. Cashiers, pharmacists, go like that. That's why I move around a lot, so I don't want to get them, right? Okay. And pregnancy, because the women, you're gonna weigh more because of water weight gain, and baby gain, okay, baby weight gain, and also aging. You could get these in your esophagus. This is with people that have eating disorders. They make themselves throw up. Okay, happens with people that are very bad alcoholics because they tend to throw up. Okay, it could be in the lower limbs. Okay, and most of the time people don't like the way they look when you're wearing shorts and stuff, so they have them taken out. Okay, or in the anal canals, the hemorrhoids. So if you're bearing down real hard to have a bowel movement, or if their bowel movement's really hard, okay, you should probably take more fiber in. Okay, what they kind of fix this, they can do. I can put elastic stocking on people's legs or sclerotherapy. They take them out. If you're gonna get your like varicose veins on your legs, don't go to a general surgeon, go to a vascular surgeon. Okay, this is what they do for a living. They do veins and arteries. Okay. If you get them hemorrhoid, again, they tend to bleed. They tend to be painful. They could rupture. So you go to colorectal surgeon, they put rubber bands on them, right? Cuts off the blood supply, and they just fall off when you have a bowel movement. Okay? Right, they'll tell you to eat more fiber. Okay, so we did this last chapter. Notice this is an anastomosis is collateral circulation. An anastomosis is collateral circulation. So all major all major organs have a double blood supply, okay, just in case something happens, so it's just an alternate route. So, and anastomosis is collateral circulation. Don't worry about that. Okay, so capillary exchange, and we've gone through this before, okay, so, right, diffusion, we're going from we're going from areas of higher concentration to lower. So, in the blood, higher concentration of oxygen going into the cell. In the cell, higher concentration of CO2, so it's going to go into the blood. Okay, transcytosis is called vesicular transport. Starts getting into and out of cells by vesicles. Okay, so an example would be insulin pulling glucose into the cell. Okay, it could be a neurotransmitter getting released from a cell, okay, from a cell, or a hormone being released from the cell. Bulk flows when we need large amounts of particles inside the cell. Okay, so if you look in here, right, this is a capillary. This is 600 times normal vision. Okay, look at the red blood cells. They just about fit in the capillary. So they got to bend when they go around, like bone and tissue and stuff. Okay, so diffusion, right? Right, it's got to be movement of oxygen, CO2, glucose, amino acids, and some hormones. And we're going from an area of higher concentration to an area of lower concentration. Okay, until it's equal on both sides. Then transcytosis, right? We call it vesicular transport. This here, right? Endocytosis, right? Conditioning getting substances inside the cell. So, osis, condition of, site, cell, endo means going in. Okay, so we're going to move across that plasma membrane. And we have that for these tiny pinocytic vesicles. Okay? And we want to get stuff out of the cell. Okay, those vesicles release the chemical. So we call that exocytosis, conditioning of things exiting the cell. Conditioning things exiting the cell. Okay, an example would be insulin with glucose. Okay, bulk flow, again, is a passive process, but we're getting a lot of particles through. So an example would be in our kidneys, right? Filtration. It's under the influence of hydrostatic pressure or water pressure, okay? Right? So it regulates the blood volume in the interstitial fluid. Okay, so we're gonna see that a little bit. We're gonna see that next semester also. Okay, so Frank-Starling's law of capillaries, this is important also. Okay, so this states whatever goes into the capillaries from the arterial end has to leave through the venous end. Okay, it's almost equal because you do have those interstitial spaces. But if we have a backup, like in a venule, okay, that fluid is going to back up into the capillaries, then back up into our interstitial spaces. Okay, that's called edema. That's called edema. Right? So peeling edema, if I push in my hand here, white it bounces out. If I pushed in, it stayed. That's edema. There's fluid in there. Okay? So as a chiropractor, we see this all the time because we do leg checks to make sure the person's balanced. So we're checking them. Okay, their ankles would be swollen. So you push in, you got pitting edema. Say, listen, you got edema, you gotta go back, you gotta go to your medical doctor. Okay, the biggest thing is with edema, the most common, it's probably just leaky valves in the veins. Remember, artery's gonna pump blood to the feet. The veins have to push it back up. So if those valves are weak, the blood's gonna pool in the legs. Okay, so that's pretty easy to fix. They can give them a compression stocking, and they'll tell the people at the end of the day, you go home, sit your legs up. Okay, and gravity will help pull it back. Okay, but you gotta make sure it's not, if they have a heart problem, you gotta make sure it's not congestive heart, okay, or there's no problem with the kidneys if they're diabetic, okay? Okay, so type 1 diabetes, you gotta watch the heart, and you also gotta watch the kidneys too, okay? So if everything else is cool, they'll probably give you a water pill, and you stay here with compression stock, you should be fine. So it's almost like, right, if the hose is like this, the water's gonna dribble out, put my finger over, it's gonna spray out. That's what the compression stock is, okay? Nice to know that's important. Okay, so we know about cardiac output, right, last time. So cardiac output is the amount of blood that leaves the heart every minute. That's cardiac output, okay? So cardiac output is stroke volume times beats per minute. So your stroke volume is the amount of blood that leaves the heart, that leaves the ventricles every time the heart beats. So one beat, okay, that blood that leaves, that's your stroke volume, okay? All right? It's about 70 milliliters. Okay, now to get cardiac output, you times that stroke volume times beats per minute. Average heart rate is 75 beats per minute. So you times that, 75 times 70, right, comes out to 5,250 milliliters. Okay, we want it in liters, so we move the decimal 3 points, okay, 3 spots, and it's 5.2 liters. So the amount of blood that leaves the heart every minute is 5 liters. Okay, it's a lot of blood, 5 liters, okay? All right, so this depends on pressure difference. More pressure difference, more flow. Okay, more resistance, less flow. So if you have some clogging of your arteries, okay, you have clogging of the arteries, okay, the heart's gonna have to work harder, right, to get that blood flow through, and that's what we don't want, okay? All right, so notice blood pressure, okay, so we'll teach you how to do a blood pressure this week. Next week we'll do blood pressures also, if you guys want to do them again. Tuesday we'll do those again. Okay, so when you're doing a blood pressure, the top number, right, so like, we said 120/80, the top number is when the heart contracts, okay? That's called systole, that's important. So when the heart contracts, okay, it's called systole. That's your top number. Okay, the bottom number is called diastole. Think D for down, D for diastole. Okay, this is when the heart's relaxing. Okay, so our target blood pressure, and now it's 120/80, 120/80. And we're gonna lower it to everyone 110/70, and that was insane because all people in the United States would be pre-hypertensive then. Okay, and there's a pharmaceutical companies who push that, so don't put people on medication. Okay, so now someone said that they might change it to 130/80. Okay, and that would be normal. That would be normal. Okay, but around here is what we shoot for, around there. Okay, it depends on your age and stuff too. Okay, so you're taking a blood pressure. We're always going to use the brachial artery. Okay, we want to do the left side if you can. Person had like cancer or something, you can't do it, so you do one time. Okay, so you're going to do it on the left side. The textbook way to take, or the real way to take a blood pressure, okay, especially if somebody has cardiovascular disease, you do it bilaterally. That means on both arms, and you do it standing, sitting, lying down. They all should be the same. Okay, if something's working right, everything should be the same. Okay, but for a base, when you go for a checkup, because everybody's basically healthy, okay, they'll just do a baseline and they'll do one arm. Okay, if you do have high blood pressure, they'll do both arms. Okay, we'll do both arms. Okay, so when you're taking a blood pressure, you kind of guess how old the person is. Okay, so I'm going to say you're about in your 20s, right? So that would be, so at 100, so that would be 120. Okay, 120. Okay, so I would pump this up to about 150. Okay, because you don't want to get what they call oscillatory gap. So we talked about that yesterday. Okay, so then you let the bag out. It's called a sphygmomanometer. We'll go over that in a second. And you're gonna let the air out. So you're gonna look at the dial. It's gonna go. You're gonna hear it. Then you're gonna hear the sound. Boom, boom. The first sound you hear, the first heartbeat you hear, that's your top number. Okay, so it'll go boom, 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 boom. Then you won't hear it anymore. The last sound you hear is your bottom number. Okay, do it again to make sure. Do it again to make sure. And you move good. Okay, all right. Where is, okay, we'll lower it together, okay? So you're gonna use a sphygmomanometer and a stethoscope. We have them in class. Okay, all right? Okay, so I like to keep it real light. So syncope means fainting, okay, or passing out. This is when you have a decrease in blood flow to the brain, for like a split second, okay? That's not due to a head injury. You didn't bang your head, somebody didn't punch you in the face, okay? So this could be this could be caused by different reasons. One could be something like an emotional stress, like a vasostressor, okay? Or a vasodepressor. So you ever see in movies that like the lady sees something like really scary, they go, "Oh, I'm gonna faint." Okay, that would be that, okay? You see something very, very traumatic and the person faints. I'll tell you a funny story on that in a second. Actually, I got a funny story for all this. All right. Yeah, go figure. All right. So this would be emotional stress, okay? So you see something that would be very stressful. So they used to say, a lady's faint, men pass out. It's the same thing. It's the same thing. So my cousin, and my aunt got hysterectomies at the same exact time. My cousin had a problem, had fibroids, and all. My aunt actually had cancer. She passed. But they were in there, in the hospital at the same time, so they moved them in the same room. One of my nurses was taking care of them, and my respiratory. My son's respiratory therapist was taking care of them. So I go in, and they both got the staples in, so it's just like, if they laugh or cough, they gotta hold a pillow, you know, the stitches, the staples. So go in, and my cousin's husband is like this big-time attorney, and he makes a shitload of money, and he's one of these people that think they know everything, which is really, really aggravating to those of us that do know everything. Like, this guy's trying to talk to me about shit in science. I go, dude, you can be not more wrong. I said, more wrong. You are so wrong that you made everybody at this table more stupid, okay? So just, talk about screwing people in your law practice and, let it go with that, right? So anyway, so he knows everything. So anyway, I go into the room, and he's got a bandage on his head, right? I go, what happened to you? My cousin goes, he fainted, he's useless, right? I go, what? And he goes, I didn't faint, I passed out. Right? Okay, same thing, right? So I go, I said, well, if you see a wound, you're not used to looking at that, that could cause you to pass out. My cousin goes, oh no, this is before the surgery. When he stuck the IV in my arm, he saw that and he passed out, right? So I go, okay, this is what you do. I go, next time you feel a little dizzy, like you're gonna pass out, go into a crouched position. So my uncle goes, that won't make you pass out? I go, oh no, he'll still pass out, I just wouldn't hit his head as hard. They all break out laughing, they're holding the pillows. He got mad at me, walked out of the room. Okay, situational would be like if you bear down, like you're gonna urinate or have a bowel movement, severe coughing, or even laughing, or even laughing. So you can see this in like a sporting event. Okay, the bathrooms are full, and they're standing in line at the urinals, right? The guy will pass out, he'll go down. That's actually kind of funny. Because if you're ever in a men's room in sporting events, that floor is friggin' nasty. I've actually thrown shoes out after I left, nasty. So we had a professor here. He was very obese at one time. He did lose a lot of weight though. He's a really cool guy. I'm not gonna tell you who it is, 'cause I don't want to embarrass him. But he had this when he laughed real hard. They gave him time this. Every time I laugh real hard, I pass out. I go, you got situational hypotension. I go, well, maybe he was working on losing weight. He did, and every now and again it still happens, and his blood pressure just drops. And you'd be in class, he'd laugh at something, he'd get all dizzy and have to sit down. So every time I see him, I try to think of the dirtiest joke I could find, and I tell him, so I'm gonna laugh, see if he passes out, So yeah, but he had this. Drug-induced. This could be if you're on antihypertensive drugs, this would be like for high blood pressure, and a diuretic. It's a water pill, if you're retaining water, okay? A lot of times this will happen, you lose the weight, you get an exercise program, you don't need drugs anymore. Okay, so this was happening to my mother. She's getting a little dizzy. I go, and I took her blood pressure. Man, her blood pressure was really low. I said, go back to your doctors. When I took her back to the cardiologist, took off the blood pressure meds. She didn't need them anymore. Okay, so now my father, he was very obese all the time, type 2 diabetes, high blood pressure, everything like that. We were watching old movies. My son's girlfriend was over, my mother was over on the weekend. So he goes in, he's showing old videos, and my father was huge. And he says, oh my God, Papa was really heavy. Yeah, well, he's not with us anymore. But he did lose weight and all. So I had to go to eat rocket right for Thanksgiving. So when I was in college, I showed my from undergrad. And so I was real skinny, and I had this cheesy ass porn star mustache, right? I told my wife, I go, why didn't anybody tell me how stupid I looked? And I would have shaved it. My roommate goes, well, we don't want to hurt your feelings, number one. So my wife goes, I thought it was so cute. She goes, I fell in love with that little mustache. So they're watching a movie. I ran downstairs to the bathroom. I shaved real quick. So I walked back upstairs, and I just had the mustache on. So she started laughing, right? All right. So my hair is really great. I just put friggin' gel in it. So this is something like this. I woke up the next morning. It was all white. And this way, I don't know, like a friggin' old shit. So anyway, so my mother and father, they like to go to Mexico. They go on vacation. They really love that. So they went down there. They went on like a cruise that they had. You can eat everything. So my father would eat his weight. Okay, and so he got something that was that. And so my mother said she raised 2 boys. She'd never seen somebody throw up and have diarrhea that much. That's how sick he was. So she just wanted to come home. So day 3 he felt better. There's nothing left in him. So he didn't eat or drink anything. He goes, all right, let's try to solve this vacation. Let's go to the beach. So they go to the beach, and he didn't eat or drink anything because he was afraid that if he had diarrhea, he would shit himself. He was going to get back to the hotel. So all day long, he's in the hot sun and he's sweating and everything, which now there's nothing in his body. He pooped it out and threw it out and sweated it out. There ain't nothing in his body anymore. So they go and they're gonna go to dinner. So he went, he took his, because he hadn't taken his pills, he took his blood pressure pill and his water pill. Okay, he took those, right? So now, he's starting to urinate now, whether he wants to or not. So they go to dinner, and he's really, really dehydrated, really thirsty. So he orders a scotch on the rocks with a splash of water. That's what he drank, okay? So he's real thirsty. When they give him the drink, he just sucks it right down. My father always had a beard, a dark beard. My mother said he turned pale white, his eyes rolled up, and he fell off the chair. So it was a New York City cop with his family on vacation. So he picked his feet up, and the blood went to his brain, and he woke up right away. And so they called an ambulance. They go, my mother said, well, we're gonna take him to the hospital. And they go, you don't wanna go to the hospital this time, because a truck comes. So a big truck came, like a tractor trailer, that was like a portable hospital. They hooked him up with all IVs, they took all films and stuff right in the truck. My father said it was actually pretty cool. And he was okay, just that he dehydrated himself really fast. That would be a condition of drug abuse. Orthostatic, it happens with a lot of older people or really anybody. If you get out of bed and you stand up quick, you're like, whoa, that's what's going on. Okay, especially with older people because they have leaky veins, okay? The valves are a little leaky. So when you're getting out of bed, remember, you're laying in bed for like 5 to 7 hours, okay? When you get up, swing your feet across the bed, sit for a couple seconds, stand for a couple seconds, then walk. Okay, give the blood a chance to flow up to the brain, okay? All right, so to control the blood pressure, okay, we could do long-term, okay, or faster, like you stand up really, really quick, okay, where you're jumping around, right? We're gonna do this next semester also. We do a nervous system, okay, but what controls your heart rate, okay, is gonna be your medulla oblongata portion of the brain, okay? It's the lowest portion of the brain, it's called the brain stem, okay? So the lowest portion of the brain stem, okay, so you got the midbrain, pons, and then medulla oblongata. This actually will go through the foramen magnum, okay, a little bit in the skull, okay? So this is for vital centers, heart rate, respiratory rate, and blood vessel diameter, okay? Right? And what comes off here, the cranial nerve, is the vagus nerve, cranial nerve 10. So your SA node, your sinoatrial node, okay, is gonna shock the heart, okay? Right, it's supposed to do this 90 times per minute, but it doesn't have to, okay? So the vagus nerve lowers it down to between 70 and 80 beats per minute, okay? Other impulses from the brain, okay, or from your body. So anything that's sensory goes into the brain, so that's gonna be input, okay? So from the anterior portion of the cerebrum, the larger portion of your brain, you got your limbic system, okay? This is your emotional centers of the brain. So if you get angry, if you get upset, okay, what's gonna happen?